Okay, you can open your eyes now. You've made it to Canada, home sweet home, where the weather is cold, the people are warm, the bonhomme is creepy, and the nail infections are invasive. This is the last scene of our antifungals chapter, and we're going to cover the newest class of antifungals, the equinocandinas, as well as some other oral antifungal drugs for mucocutaneous infections. Well, as you can tell by the sepia countryside, this sketch takes place back at Dorothy's farmhouse. It was a simpler time, before that freak windstorm carried us off to the parallel Canadian dimension, before the scarecrow became self-aware and started asking uncomfortable existential questions. And the Tin Man, just look at him, rusty and inanimate, just some forgotten contraption behind the farmhand's shed. See those ring-shaped spots and that unfortunate crotch rust? Remember that our tinea tin man represents dermatophytic infections such as tinea corporis, tinea pedis, and tinea cruris. Nothing a little grease can't fix. Take a look at this curious canic who's applying grease to the mouth of our rusty tin man. He represents Gricia fulvin, a fungostatic drug administered orally to treat dermatophytosis. Because it accumulates in keratin-containing tissues, it's most effective in treating tinea infections of the scalp and skin. In fact, oral Gricia fulvin is one of the first-line therapies for tinea capitis in children. Aw, and look at that farmhand son who found a little tinea tin man cap of his own. I just want to pick him up and give him a tetanus shot. With prolonged treatment, can also be used to treat dermatophyte infections of the nails, though relapse is common. This is depicted by the farmhand's greasy and unsightly nails. That's definitely going to need some long-term treatment. After years of neglect, in addition to developing a major rust problem, this Tin Man is also covered in overgrown vegetation. See the shape of the vines crossing over each other as the farmhand tears them away? Looks kind of metaphase-y, almost like a spindle apparatus if you ask me. Well, Gricia fulvin works by binding to fungal cell microtubules, a fungostatic mechanism of action that halts mitosis. Remember, Gricia fulvin greases up and inhibits fungal microtubules. Adverse effects seen with Gricia fulvin therapy include GI distress, headache, and rash. Serious side effects include hepatotoxicity and granulocytopenia. However, on a test, the important reaction to remember is activation of the cytochrome P450 system of the liver. In the back, we'll sketch in another farm mechanic greasing up the engine of a tractor. Notice that this tractor has a shiny chrome bumper, along with our recurring symbol for cytochrome interaction, the CYP450 license plate. Specifically, Gricia fulvin activates the CYP450 system as indicated by the other grease monkey who's giving him the old thumbs up. Looks like this CYP450 engine is running smoothly. Gricia fulvin has largely been replaced by newer antifungal medications such as terbinafine. In Sketchy Micro, terbinafine was represented by the outlandish turban worn by the great wizard himself. But just like in Frank L. Baum's original story, back in Canada, the wizard is just the eccentric and possibly homeless Professor Marvel, just a traveling soothsayer. And what sooth does he see in his crystal ball today? What the... That Tin Man is going to spring to life at any moment. Don't touch that thing. Topical terbinafine is used to treat dermatophytes, just like the Tin Man he now holds in his hand. Along with Gricia fulvin, oral terbinafine is the first-line agent for treating tinea capitis in children. Remember the endearing farmhand to be wearing his little Tin Man cap, standing between the grease and the turban. When given orally, terbinafine is especially effective against onychomycosis. And that's why our fortune teller nervously bites his fingernails. Like Gricia fulvin, terbinafine deposits in keratin-containing tissues. But unlike Gricia fulvin, it is fungicidal. Like the azoles, it interferes with ergosterol synthesis. Remember that ergosterol is the main component of the fungal cell membrane, not cholesterol, as represented by the sign that reads non-sterile. While azoles worked by interacting with the cytochrome P450 system, terbinafine inhibits the fungal enzyme squalene epoxidase. This leads to the accumulation of the sterol, squalene, which is toxic to the cell. On our farm, accumulated squalene is represented by the accumulated squealing pigs in the pen. Adverse side effects are rare, consisting mainly of GI upset, and that's why we've sketched in some diarrhea-evoking mud puddles. Patients receiving terbinafine for onychomycosis should be monitored closely with periodic laboratory evaluations for possible hepatic dysfunction. This possible hepatotoxicity will be represented by the liver-shaped mud spots on the squealing pigs. Let's finish off this sketch with the equinocandinas, or as I like to call them, the equinocandinas. These include caspofungin, mycofungin, and anidulafungin, all embodied in this stylish equinocandian fur cap. Remember, fur cap for caspofungin. Equinocandinas act at the level of the fungal cell wall by inhibiting the synthesis of beta-1,3-glucan. To remind you of this disruption of the fungal cell wall, we have this crumbling brick wall behind our equinocandian. Because caspofungin and the other equinocandinas block the synthesis of glucan, a major polysaccharide component of the fungal cell wall, we've designed this wall of the glucan transport truck to resemble a polysaccharide structure. Remember, on an exam, what will differentiate equinocandinas from other antifungals will be their action at the fungal cell wall, not the fungal cell membrane, and their inhibition of polysaccharide synthesis, not ergosterol synthesis. Equinocandinas have excellent activity against Candida, as represented by our recurring Candida Canadian flag, along with the characteristic patches of white snow. Specifically, remember that these agents are given IV for systemic candidal infections. Notice that around the Canadian flagpole, we've included our recurring symbol for IV administration, a growing vine of ivy. Equinocandinas are used for mucocutaneous candidiasis, candidemia, and even prophylaxis of candidal infections in transplant patients. Remember, treatment of esophageal candidiasis, such as in HIV-infected individuals, requires systemic, not topical antifungal agents such as fluconazole, equinocandinas, and amphotericin. Let the snow inside these big upright exhaust pipes on the truck remind you of candidal infection of the esophagus. Caspofungin can be used in invasive aspergillosis, usually in patients who have failed to respond to amphotericin. And just for good measure, we'll sketch in our aspergillosis scarecrow with those characteristic hyphae-ridden lungs. Echinocandin agents are extremely well tolerated, with minor GI side effects and flushing reported infrequently. Specifically, anidulafungin may cause histamine release during IV infusion, but side effects caused by these friendly Canadians are likely low yield on the exam. So let's sum up this sketch, shall we? Griseofulvin is an oral fungostatic agent that works by binding microtubules and halting metaphase. It accumulates in keratin-containing tissues, so it can be used to treat dermatophyte infections such as tinea corporis, pedis, and cruris, as well as dermatophyte infection of the nails, as represented by those greasy fingers. Griseofulvin can have serious side effects, and remember that it activates that P450 metabolism, so it's largely been replaced with other drugs such as terbinafine. This soothsayer works his magic by inhibiting squalene epoxidase, thus inhibiting ergosterol synthesis. Terbinafine is also given orally to treat dermatophyte infections, especially onychomycosis. Along with Griseofulvin, it's one of the first-line drugs for treating tinea capitis. Our echinocandin in the back represents caspofungin and the rest of the echinocandins. They inhibit glycan polysaccharide synthesis and work on the fungal cell wall, not the membrane. They have excellent activity against Candida infections, including Candida esophagitis. Well, this is the end of our antifungal story. It's time to move on to viruses. Though I will say, I'm going to miss Candida. If we learned anything today, it's this. If you ever come across a turban-wearing homeless man who beckons you to come inside his motorhome/fortune-telling booth, just say yes.